Welcome to yet another episode of Ask Dr. Leila podcast season 2, where we dive into the beautiful journeys of all our specialists here at LHDM. Today, it's an honor to have Dr. Abdelhakim El-Gheriani with us. Our guest today is a true expert in the field of orthodontics. He's a member of the LHDM family, a diplomat of the American Board of Orthodontics, and the UAE ambassador for the American Association of Orthodontics. With postgraduate training from the University of Colorado, USA, and a rich academic history that includes serving on the faculty at the University of Pittsburgh and the European University College in Dubai, he brings a wealth of expertise to our clinic. Please join me in welcoming the remarkable Dr. Abdelhakim.
Thank you. Thank you very much. That's very nice.
Let's start by getting to know you better, Dr. Hakim. Could you tell our listeners a bit about your background and what led you to become an orthodontist?
Sure. Thank you again for the fantastic introduction. My background is that my ancestry is Libyan. I was born in the US and I was raised in the UK, so it's kind of a cocktail there. I got into dentistry. My father's a dentist. He's a prosthodontist. He was the dean of a dental school. But I veered track after getting into dental school and chose orthodontics. Why orthodontics? Well, I'm interested in research. I'm interested in craniofacial development. And orthodontics is the field of dentistry that deals with how the face, how the teeth, how the bite develops. So this is why I chose orthodontics. In addition to my dental training, I also have a master's degree in human genetics as well.
Amazing. That's truly impressive. Now, can you tell us more about your role here at LH and the orthodontic services you provide to our lovely patients?
Fantastic. I love it here. We work as a team, and my role as an orthodontist at LH is to deal with patients who have specifically only an orthodontic problem, and I take care of that whilst they're having their regular dental care followed up by either yourself or one of the other team members, and obviously Roxana. In addition to this, I work with you and Dr. Mauricio and the other specialists in preparing cases to receive restorative treatment. So perhaps a patient needs a full mouth rehab and the teeth need to be put in a more ideal position. That would be my job, where in those cases, you are the architect and I'm the contractor. And we've said this quite a lot. So I have two roles. One is as an orthodontist from A to Z in orthodontic cases, or in orthodontic preparation for the major restorative cases.
Absolutely. And I can attest to our teamwork here, which our patients really feel it. It's fantastic because we count on each other to provide the best result for our patients.
Absolutely.
So beyond your clinical work, you've also been involved in some exciting projects and have been invited as a guest speaker at international meetings. Could you share more about your passion projects and your experiences as a speaker?
Yeah, thanks. I actually, on the 5th, last week, I was presenting in Amman. I was invited by the Jordanian Orthodontic Society to give a one-day course on aligners. Prior to this, I've lectured in Kuwait. I've lectured in Beirut, Lebanon. I've also lectured extensively here in the UAE and in the US. And I'm excited to be visiting other countries very soon. What I'm passionate about mostly is now recent developments in dentistry, primarily with aligners and the use of mini screws, and how we can do things that previously we could never do. So this is very exciting, and I'm glad that we can offer this service here at LH.
The future is amazing. And I've always been told this quote that, well, it's not really a quote, but the fact is you really know your stuff when you teach it. And we learn so much from our students.
Of course.
So I'm sure every time you come out, gaining even more expertise.
Yes.
So I'm sure you've had some incredible patient experiences in your career. Can you share a particular impactful patient story?
Yes, absolutely. When I finished from the University of Pittsburgh in 2002. It seems that's over 20 years ago. And at the time, even though at the time we felt dentistry was very well developed, now when we look back, it's come so much since then. And one area of particular interest is patients with special needs. patients or people with determination. And what we could do now, especially with aligners, why we can provide great results orthodontically, where with the traditional fixed appliances we could never do. In fact, it was a contraindication because of the wires, the brackets. If there's an emergency, it's just how you place the appliances. It was just impossible to be able to do on patients with special needs. And now with aligners, with digital scanning, we have patients who are obviously having this condition that we can, provide them great smiles, which is something for me is incredible.
We've come a long way with dentistry, I would say.
Absolutely, yes.
And here at LH, the beauty is we have both services available for all our patients, from a young age to adults. So aligners are no longer, as you mentioned, just for adults. They can be used for teenagers or even younger. Or we have the traditional braces. So before we wrap up, what advice would you give to the aspiring orthodontists that are considering a career?
Yeah, I think it's great. I think I love being an orthodontist. I love being part of the dental profession. Orthodontics is a training that you would receive after completing your basic dental degree. So the entry to orthodontics is through dentistry. So I advise anyone who's interested to get good grades, study hard in school, get into dental school. And while you're in dental school, if you want to stay with orthodontics, great. Otherwise, there's many other specialties in dentistry I'm sure you can really enjoy. But it's a long journey. It's a long journey. But hopefully at the end of your journey, it'll be worth it just as much as it's been worth it for me.
I'm really excited because my son Farbud may follow your footsteps, Dr. Hakim, and become an orthodontist. So he has a great mentor.
No, thank you. Thank you.
Thank you, Dr. Hakim, for sharing your remarkable journey with us today and spending the day this morning with us.
Well, thank you very much. Thank you for having me.
And to our listeners, thank you for another week of Ask Dr. Leila podcast. I look so forward to introducing our next remarkable team member, and enjoy the week, everybody.